Welcome to an introductory video on Lessac-Madsen resonant voice therapy.
In this video, we will provide you with the description, the expected length, information regarding who developed the program and who it is intended for, the rationale behind it, the vocal outcomes, the efficacy, and the protocol.
Our video will conclude with a demonstration of 2 of the resonant voice exercises.
Lessac-Madsen Resonant Voice Therapy, abbreviated RVT, is a program which modifies introductory approaches into resonant voice training and incorporates a training program that leads to a stronger resonant voice. The program includes a patient manual, a clinician manual, and a DVD. RVT was designed by Dr. Verdolini-Abbot to honor 2 great mentors and voice teachers, Professor Arthur Lessac and Dr. Mark Madsen. According to the Manual of Voice Treatment, Pediatrics through Geriatrics 3rd edition, RVT combines principles of motor skill learning, aspects from Lessac's theater methods, and Madsen's education in singing voice into one approach. The program is conducted during 30 to 45-minute sessions once or twice weekly for 4 to 8 weeks. RVT is appropriate to use with adolescent and adult voice patients with hypo and hyperfunctional voice disorders associated with phonotrauma and patients with paresis and paralysis. A formal certification program is not necessary to implement this technique. However, Dr. Verdolini-Abbot holds workshops to teach the detailed steps of the program.
The rationale behind resonant voice therapy is that it promotes limited vocal fold adduction, which counteracts hyperfunctional voice behaviors, or limited vocal fold abduction, which then counteracts hypofunctional voice behaviors. The premise for resonant voice therapy is that, according to Sapienza and Hoffman-Rudy, the basic premise of resonant voice therapy is that a target laryngeal configuration produces the strongest voice while using the least amount of respiratory effort and impacts stress on the vocal fold, thus reducing laryngeal injury. Another premise of the technique is that outcomes of the resonant voice therapy can be enhanced by attention to sensory information relative to gestures rather than verbal, mechanistic explanations. The vocal outcome for resonant voice therapy is for the patient to maintain a strong vocal quality, which you can start to see after about 3 to 4 weeks of therapy. The efficacy of resonant voice therapy has not been well tested in experimentally controlled studies. Much of the research available lacks a control group, lacks large numbers of individuals, lacks male participants, or the studies don't strictly follow the resonant voice therapy protocol. Within a meta-analysis research study we found on vocal treatment, it stated resonant treatment was used to treat 4 clients by Letty and Associates in 1997. The clients in this research study reported that treatment was effective.
Alright, now I'm going to be talking to you about the resonant voice protocol. In the clinician's manual, you will find a chart for the protocol. So how it works is, there are 9 different exercises that are incorporated throughout 8 sessions. So we'll just take a look here about the different 8s. So the first one is a discussion of vocal hygiene, followed by stretching exercises, core exercises, chant exercises, vocal communicator, voice minis, resonant voice, misa de voice, conversation, and own treatment. So here, the first few sessions are kind of more targeting the vocal hygiene, the stretching, followed by working on the resonant voice in syllables, words, and phrases. And as you move through the sessions, you work more into sentences, conversation, and then followed by the own treatment at the end, when they'll do their monitoring at the end of therapy. Okay, so today I'm going to be demonstrating 2 exercises of the resonant voice therapy. The first one is resonant voice, misa de voice. This exercise is incorporated into sessions 4 through 7, and the goal for this exercise is to increase loudness. So first what the client would do is practice a crescendo over a count of 4 seconds, and then a decrescendo over a count of 4 seconds. Followed by, in the clinician's manual here, there are 2 lists of words that you can use to help you increase loudness. So today, Chelsea, what I'm going to do is I'm going to pick a word, and then I'm going to gradually increase loudness and then decrease loudness, okay? So when we're working on this, the important thing to remember is to maintain that resonant voice and feel those vibrations in the front of your mouth, okay?
Okay.
So the first word we're going to do is mood, okay? So right before we start, let's just get our You feel that vibration? And you feel its easy voice?
Mm-hmm.
Okay, so throughout this, I'm going to be asking you those questions just to make sure. If you say yes to both of the questions, that means that you are using a resonant voice and you are doing it correctly. Alright, as I'm demonstrating this to you, I will use my hand to help me guide me through the word and through the loudness. Feel free if you'd like to use that. So this is how it's going to work. Mood, 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 mood. You try.
Mood, 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 mood.
How did you think you did?
I could feel the vibration.
Good. And was voice easy?
Yep.
Good. So what we would do is we would practice this a few times until the client has mastered, and then we would move on to another word. However, if the client is just having difficulties with the word, instead of continuing on with the word, we would just try to choose a different word and come back to the word at a later time in the session or at a different session. Alright, let's try another word. Let's try the word zip, okay? So we'll just start first with that sound, so zzz, okay? So this is how it's going to look. Zip, 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 zip. You try.
Zip, 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 zip.
How did you think you did?
The Z is harder than the M
Mm-hmm.
to get the vibration.
Did you feel the vibrations at all?
Sometimes.
Yeah. Okay. And was voice easy or hard?
Easy.
Okay. So now what I'm going to do is I'm going to demonstrate an example of using a non-resonant voice versus a resonant voice, okay? And I want you to tell me which one is which. Ready?
Yep.
Okay. Zip, 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 zip. Okay, that's A. Or B. Zip, 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 zip.
The first one you used your resonant voice.
Because I felt the vibrations, I had an easy onset, and I had a gradual zzz instead of a hard, right? So that's what, for resonant voice, we're trying to barely abduct those vocal folds. So if we say it really fast and loud, that's when we put too much pressure on them and further damage them. So that's why we want to have a gradual increase into the word. All right, let's try one more. We'll try van. Okay, so we'll just try this, the sound first. You feel that? That's easier to feel, right?
In the Mesa de Voice demonstration, Stephanie modeled each exercise to Chelsea prior to her practicing the words mood, zip, and van. As Chelsea mastered these words using her resonant voice, Stephanie faded the cues and asked Chelsea how she thought she did. This provided Chelsea the opportunity to learn to self-monitor and self-correct.
The second exercise I will be demonstrating from the resonant voice therapy is the chant exercises. This exercise is incorporated into sessions 2 and 3. The patient practices nonsense syllables and spoken phrases. While the patient is practicing the chant exercises, the clinician will ask if they feel the vibrations and if voice is easy. Alright, Kelsi, so right now we're going to work on the chant exercises, okay? And what the sound that we're going to be working on is so get that You feel those vibrations?
Yes.
Okay. So this is what we're going to do. We're going to say me, and you can use it in a bit of a singing tone, and we're going to say that 6 times, okay? So I'm going to model it first, and then I would like you to repeat me. And just remember, while we're doing this, to maintain your resonant voice. Alright, here we go. Me, 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 me. You try.
Me, 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 me.
How did you think you did?
Really well.
Yeah, did you feel the vibrations?
Yeah, I did.
Yeah, and voice was easy?
Very easy.
Perfect. So we'll just practice that a couple times with the client until they feel comfortable doing it, and then we move on to the second step, which is adding a voiceless sound. So Kelsi, what we're going to do now is we're going to add the voiceless sound P in the middle, okay? So what it's going to look like is me, me, P, P, me, me. You try.
Me, me, P, P, me, me.
How did you think you did?
I think I did good.
So the reason why we put that voiceless sound is because we're not going to have vibrations because it's a voiceless sound, so you won't have those vibrations. So we're kind of getting you to have a feel for when you do have those vibrations compared to when you don't. Okay? So let's try that one more time.
Me, me, P, P, me, me. Now that you said that, I can really tell the difference.
Good. Alright, so once you've done that a few times with the client, then you'll move on to the next step, which is using words in a phrase. Okay, Kelsi, now what I'm going to do is I'm going to use real words and put them into a phrase. So it's going to look like this. Meet me, Peter, meet me.
Meet me, Peter, meet me.
How did you do?
I think I did okay that time.
Did you feel those vibrations?
I did on the M sounds.
Perfect. And was voice easy? Good. Okay, so we'll do that a few times with the client, and then once we've done that, then we'll move on to the next step, which is repeating the same phrase, but we're going to increase inflection, okay? So this is what it's going to look like. Meet me, Peter, meet me.
Meet me, Peter, meet me.
Did you feel those vibrations?
Not very much that time.
Okay, so we're going to try it again, okay? And what I want you to really focus on is trying to get those vibrations. That means that you're using your resonant voice, okay? Meet me, Peter, meet me.
Meet me, Peter, meet me.
How was that one?
That was better. That time I paid more attention to it.
Good, and you felt those vibrations and voice was easy?
Right, yes.
Good. Okay. Okay, Kelsi, now I'm going to ask you a question. And after I ask my question, I would like you to respond with, meet me, Peter, meet me. Okay? The first time I want you to do is I want you to try to sing it a little bit.
Okay.
Remember to use that resonant voice. Hi, my name's Peter. What am I supposed to do today?
Meet me, Peter, meet me.
How did you think you did, Kelsi?
Good for a first try.
Did you feel those vibrations?
I really did.
And was voice easy?
Quite easy.
Yep. So in that case, if you answer yes to both questions, that means you are using your resonant voice.
Good.
So now what I'm going to do is we're going to try it one more time, and I'm just going to show you how I'd like you to try it, okay? So I'm going to say, hi, my name's Peter. What am I supposed to do today? And this is what I'd like you to do. Meet me, Peter, meet me. Okay? So just more natural, but just remember when you're doing it more natural that you have to use that resonant voice and get those vibrations. Okay? Hi, my name is Peter. What am I supposed to do today?
Meet me, Peter, meet me.
Nice. I heard those vibrations. Did you feel them?
Yeah,
Yeah, and you had the easy voice?
I did.
Perfect. All right, so we just went over an example of one chant exercise. Each session has about 3 different chant exercises that you can use. The session that I did was session number 2. So for this one, it just used the M sound, so different syllables with M. And then we would just continue on to the next exercise.
In the chant demonstration, Stephanie modeled each step to Kelsi beforehand. Stephanie gave specific instructions for each step and how to maintain a resonant voice. As Kelsi mastered each step using her resonant voice, Stephanie faded her cues and asked Kelsi how she thought she did. This teaches Kelsi to self-monitor and self-correct.
All right, one of the most important aspects of resonant voice therapy is implementing home programming. The work that the clients do between weekly therapy sessions will be the source of their greatest benefits of therapy. The clinician will provide instructions and complete the home programming form for the client. The home programming will vary from session to session depending on which activities are targeted.
Thank you for watching our introductory video on the Lessac-Madsen Resonant Voice Therapy.
We hope you enjoyed our video and learned a great deal of information.
If you'd like more information, please look at our resources provided in the credits.